What are you noticing with possibility of big pharma not being able to advertise, and why do you even support that?
Well, you know that the US and New Zealand are the only two companies in the world that allow pharma advertising on television. It's just an insane thing. Why is a drug company circumventing your doctor, that relationship is sacrosanct? Why is a drug company getting to tell you what you should be asking your doctor about it? I'm a doctor. I'm a traditionally trained medical doctor. So when a patient comes to your office and says, "Doctor, I want this drug," it's kind of hard for the doctor to say no if the drug is in some way indicated. It puts a lot of pressure on the doctor that they shouldn't have. And it's not the right way to do things. And a lot of times doctors who on average get around 7 to 8 minutes with every patient in this insurance-driven model that really hamstrings doctors in a way that's very strange and limits their amount of care, time with every patient. A lot of doctors are kind of stuck and just say, I just need to give the patient something so they walk out of my office happy, which isn't the way it should be, but that's the situation we've created for doctors. So to stop pharma advertising would simply be incredible. It would be a really great step in the right direction. And whatever companies go out of business, they should be out of business in the first place.
Have you ever asked your doctor for a drug? Because if you have, that's exactly what Big Pharma wants. Pharma spends $6 billion on direct-to-consumer ads in the US. And this isn't about educating people about the drugs. It's about increasing demand and normalizing medication use. If a drug is truly necessary, you wouldn't need to advertise it to patients. They would simply go into their doctor's office and the doctor would prescribe it. However, just like this guy's saying, when you have 8 minutes with each patient and someone comes in asking for a drug and you just prescribe it to them, they're going to leave happy and you're going to be able to go on and see the next person. And that is a horrible thing about our insurance-based system, that doctors are incentivized to simply do that because it's easier to move on to the next patient and simply just bill them. It's terrible.